Now, in this trial, you found that there wasn't really too much of a difference in outcomes, it seems like, with these patients. But even the home monitoring and allowing them to have sort of more of an outpatient approach didn't really improve quality of life. How much more do we need to see from home monitoring and technologies in the heart failure space before this becomes a really sort of reliable approach for clinicians?
So, I mean, the study, thanks for pointing it out. I mean, the study went a bit under the radar because, you know, people tend to just want to focus on positive results. And this one was a neutral finding. But to point out, this is probably one of the most rigorous trials that have ever been done in that context. So essentially, both intervention and control group received the same kit, the same hardware. And by doing that, we could eliminate the impact of one group getting a bit more attention and the effects, in particular for things like quality of life, being driven by because people feel that they're being given, you know, better care. So we eliminate that by giving essentially the patients the same kit, and so they were not aware of which treatment they're receiving. By doing this, you know, we were expecting to just see, you know, if they assess whether there is a real effect of intervention between the two groups. But the study was too small. I mean, it was intended to be a pilot trial, you know, 200 patients that were randomized, but the signals were not strong enough to see that. It wasn't the case that there was no effect. It was that the effect just was not significant. It was going in the right direction, but it was not significant. But coming back to the initial point, detecting a difference in quality of life, I think is a tough bar. So the focus here was on optimal medical management, and for that the trial was simply too small. But that certainly challenges some of the findings from the more positive headlines that some other studies had created, implying that there could be a marked effect. Here, certainly in this rigorous design of taking the hardware out of the equation, we managed to get a clearer answer on that particular question.